So what about an alternative? Well, one alternative is a revealed preferences approach. And this is particularly liked or favoured by economists. Economists maybe are cynical. I would say it's more realism than cynicism. But economists think that people reveal their true preferences in their behaviour. It's what we do that speaks about our preferences. This is, in English, sometimes summarised as an aphorism: actions speak louder than words. And I'm sure virtually every country probably has a similar saying. If you ask somebody how they value something, there's all sorts of possibilities they may misrepresent their true value. Whereas if you observe the choices somebody makes, it's far more revealing about their preferences. Now that principle doesn't seem too bad. It's probably quite a good way of finding out about people's values. The challenge, however, is to do it in practice, because in practice, all sorts of factors influence behaviour, and only part of that behaviour is being driven by differences in people's preferences. We do have various techniques that have been developed. There's something called hedonic pricing. The idea here is that the overall price of a good or a service is based on the individual attributes or elements the good provides. The easiest way to describe this might be an example. If you rent or indeed buy a house, somewhere to live, the amount of rent you pay or the amount you have to pay to buy the house will depend on things like the age of the property. It'll depend on how many rooms it has. It'll be influenced by its location. Location might be important because of closeness to shopping or educational opportunities, or closeness to transportation opportunities. Indeed, it might be the location also has an influence on things like noise levels, has influence on air pollution and things like that. So there's lots of different characteristics. And so the hedonic pricing approach recognizes this and tries to explain the rental price or the purchase price in terms of the characteristics. And one way of using this in the health context, and has been used, is to see how much people value clean air. Because if you have cleaner air, you have fewer respiratory problems. And it's getting quite a tenuous link, but we're going from the rental price, linking it to the characteristics of the location, part of which are environmental, and we're getting a link between people's willingness to pay more for a better environment. And then, having got that link, you can look at differences in rates of respiratory conditions between areas and make a final jump or link where you say, well, therefore, the amount people are willing to pay for accommodation and paying more for clean air translates into willingness to pay this amount additional to have fewer respiratory problems. But it's all a bit tenuous. Another method is called the travel cost method. This comes directly from environmental economics literature, where we have a bit like health, we have difficulty valuing environmental goods. And one approach has been to see what costs people are willing to incur in terms of travel in order to visit sites that have particular environmental properties. And that approach has been used. Not very easy to use in a health context, but there are some examples where individuals trade off money and risk to their health. The idea here is, and it's back to hedonic pricing, that other things being equal, a job that's riskier will have to pay more money to compensate individuals for accepting that higher risk. And if you can identify that risk money payment relationship, this gives you an opportunity to say how much people are willing to pay in order to have less health risk. It does fall down a little bit that, for example, in the United States, it used to be, this is before smoking restrictions, one of the riskiest occupations was bartender. And they had a very high risk, mainly because of the smoke they were inhaling courtesy of their customers. Probably also high risk because of their access to alcohol led to higher consumption, and no doubt they're also sometimes exposed to more violence and things like that. But of course, bartenders are not particularly highly paid. And so it seems a little bit implausible that we can establish a relationship between high risk and then higher payment, because this occupational group were the highest risk, but among the lowest paid. But you can see the principle. And certainly there have been numerous studies which have established some sort of trade-off between the salary paid and the riskiness of the occupation. And that can then be translated into what are called willingness to pay for statistical life. But it's kind of fringe activity. It's interesting for academic economists to write quite interesting papers, but it's not really telling us much about how we value health.
Question?
Yes?
But isn't that exactly what people do, the so-called health economists, when they talk about the economic loss due to depression, due to absenteeism and presenteeism? They value it.
Well, actually, what we do there is echoes of human capital. We say that such and such a proportion of the population are absent from work because of, say, depression. And if they didn't have depression, we assume they would be at work, and then we can look at how much they're paid, and we can sort of gross it up. And so it produces these figures of, it costs the economy X trillion per year. It's not it's not really health economics, it's advocacy. It's people saying, look, this is an area that we should pay more attention to, and here's some big numbers to justify why we should pay more attention to it. Burden of disease, cost of illness studies tell us rather little that helps decision making. The essence of decision making is identifying changes we could make and then considering, compared to what we do now, this change, what will it cost us and what benefits will arrive or can be expected? And that's where economics is having some value. Now, figures about what it costs the economy per year because of depression don't tell us that. They don't give us any insight into the additional benefit we can get if we do things differently, if we organize our services differently, if we change the health technology we're utilizing.
Yes and no, in the sense that if you have that, the results of a trial that shows treating everyone with depression brings back the productivity to a certain level, then you can calculate that by treating all these people with depression in the workplace, the productivity the loss due to lost productivity will be reduced by whatever amount.
I'm not disagreeing. We can certainly do that, but these studies that sort of gross up the costs and say, look, depression or diabetes or dementia they don't have to begin with D, it just comes out better. They're costing us this amount. That sort of study is really just trying to attract attention. And I'm not saying that's wrong, but that's not really what these methods are for. And what these methods are for is the example you just gave, that yes, we've got some evidence that this intervention works. This is the magnitude of the effect. Let's now consider how much benefit that's producing and how much it's costing us to achieve it. Because then we can make a much more informed judgment if this is a good development. But revealed preferences is not going to give us this value. Basically, there's just too much going on affecting people's behaviour for us to reasonably isolate that part which tells us people's willingness to pay for a health benefit.